Are you struggling with chronic back pain and seeking relief without drugs or surgery? This video is for you. In this video, I'll be going over the 3 powerful exercises, stretches, and strength exercises, specifically targeting to relieve chronic lower back pain. These exercises are a part of the process I have refined over the last 32 years of clinical practice to help give you relief as soon as possible. If not managed properly, chronic back pain can lead to chronic disability in how you can move, how you feel, how you sleep, the overall pain in your life, the ability to socialize with your friends and family, and even to earn a living. Skipping even a single part of this video could be the very reason you do not recover or you're not able to help manage the chronic back pain you've been suffering for years. So make sure you follow all the steps in this video right to the end. Not only will I demonstrate the videos, but I'll show you the exact repetitions and movements and frequency you should do them to get the best relief possible. You don't want to miss that because I'll demonstrate it near the end of the video. As an added bonus, I'll be revealing an additional part of the healing process, one of the most nutritional deficiencies that lead to chronic inflammation. And this one single supplement that has been shown in research to be extremely effective in reducing inflammation and helping relieve many chronic low back pain disorders and other inflammatory conditions as well. Hi there. I'm Dr. Kahlid Mankal, a corrective care chiropractor based out of Ottawa, Ontario, Canada. Over the past 32 years, we have helped thousands of patients using our non-surgical methods. Our unique neurostructural program has helped many people with spine-related disorders such as hyperkyphosis, scoliosis, chronic low back pain, degenerative arthritis, headache pain. So go ahead and smash that subscribe button if you want to receive natural, healthy tips and strategies of how to improve your posture, reduce pain, and gain a healthier, active aging process. Exercise is one of the most effective ways of reducing chronic back pain. Exercises strengthens muscles, improves circulation, improves flexibility, and releases the body's natural endorphin pain relieving process. The key is knowing which exercises are the best to do. So let's get started. Okay, there's 3 exercises. One of them is called the Camel. It's a way to create some mobility, decompression of the discs, opening up of the nerve channels, bringing blood supply to an area. And also I feel it actually ignites a bit of the core process, which we'll show you here. The second one is a great knee to chest to open up the lower back joints and to bring in flexibility to those muscle systems. And the last one is purely a core exercise that's been known to call it the McGill curl up. These are the 3 things I do on a regular basis. It's kept me stable and pain-free for my career, from bending over a lot of people. So let's get started here. So the first one is this cat camel. So what you're gonna do is you're gonna go on all 4s, hands and knees just like that, right? We're gonna bring the head slightly down and we're gonna push up to your middle of your back toward the ceiling. Hold 3, 2, 1, and then back down. I'm going to look up with my head. I'm going to arch my lower back like a cat stretching. 3 seconds, then the opposite way. Head down, push the mid back up to the ceiling. 3, 2, 1, and then back down. Create an arch in your lower back, head up the other way. And this process you'll continue doing about 8 to 10 repetitions. So flex, arch the mid back, head down, head up, arch your lower back, maybe stick out the bum a little bit so you can get arch the lower back, and continue 3 to 5 second holds, just like that. It creates this mobility in the disc spaces and the joints. It ignites your stomach muscles to give you some support. So this is how I start to kind of create a warm-up and also to create some decompression within the disc spaces that many people have some problems with. So that's the first one. Next one is this knee chest. One of my favorites, feels really good to do. You lie on your back. So lying on your back, we're gonna pull one knee just above your knee, pull it right up to your chest, just like that, as much as you can. If your knees bother you, you can go under behind the knee and pull up that way. Okay, we're gonna pull upwards and get a hold for about a 10-second count. Once we're done, it's just the other leg. So we're gonna let it down. We're gonna bring up the other leg. If you can handle it here, pull up towards your chest. Make sure you're breathing, about 10-second holds. Again, if it bothers you, go behind the knee, pull up that way. After you do one leg at a time, then we're gonna do the double. We're gonna pull both knees up, just like that, as much as you can, or behind the knees like that. 10 seconds. And then you'll go through that process a few times to create that mobility and flexibility in your hips and then to the lower back. The third exercise is gonna be that McGill curl up, to add the strength or the tone or the canister, as they call it, in the core to create a stable lower back. And so most people have some degree of weakness in their core. I found this one to be really effective because it doesn't require you to do a full type sit-up. It's more of a static, mild shortening of the abdominal muscle at the front. So here's how it looks like. So we're lying on our back, hands just underneath your lower back. One leg is straight, one leg is bent, okay? One leg is straight, one leg is bent. The goal here is to lift your upper back toward the ceiling. We're not flexing the neck, looking down like that. The goal is to use the abdominal area, and we're going to, as you breathe out, we're lifting the upper back off the floor of the table. 5-second hold and relax. So, all right, so as you breathe out, I'm going to use my stomach muscles and I'm going to press forward to the ceiling and relax. So we're going to do each side several times, at least 8 or 10. Then we're going to switch legs. This one is bent, this one is straighter. And then we're going to, again, as you breathe out, make sure not to curl your neck like this. I want you to focus on lifting your upper back, whatever you can do, an inch off the floor or 2 or 3 inches, but you're going towards the ceiling. Straight up, hold 5, 4, 3, 2, 1. A lot of you'll notice that your stomach will start to shake, and that's perfect because we want you to engage the core. That means you're activating that core, okay? So again, hands just below the back. Breathe out too as you do it. I find you can control and sustain better. And you can even press your hands a bit into the ground or floor to be able to help to engage you if your core is really weak. But again, I want you to make sure you're using your stomach muscles and not so much your neck. So just do whatever you can, and soon enough you'll be able to get 3, 4 inches off the floor, just like that. Okay, so that's the McGill curl up. Works fantastically well. Okay, so that's the 3 exercises. Okay, so as promised, I now wanted us to summarize the exact number of reps and sets you should do, the ones that I tell my patients do on a regular basis. So let's go through them. So the cat camel exercise, if you remember, if you forget anything you remember, just remember the number 10. Okay, 10. Because 10 is enough repetitions to start to engage the tissue, to make a change in the memory, the tone, the flexibility. So up and down is 1, so do that 10 times with the cat camel. And again, you're gonna hold for about 3 to 5 seconds on each cat and each camel to allow the tissue to change its viscoelastic properties. So 10 repetitions, 3 to 5 second holds on that one. The knee chest, same thing. 10 repetitions on the single leg, 10 on the other leg, and then 10 on the double. Again, how long? 10-second holds are fantastic. The McGill curl up, that could be difficult for some of you who have, or just getting engaged in getting your core stronger and tighter. You may start with 3 to 5 on each leg, on each side when you do it. And again, we're looking at 3 to 5 second hold to engage the core. Once you get a bit stronger, definitely head to 10 repetitions on each leg, holding still again for about 3 to 5 seconds. Doing these consistently, at least twice a day. In the morning is a great time that I recommend because people are generally a bit stiffer. So if you can get up about 10 minutes earlier, start to apply the exercises to wake up the spine, wake up the tissues, and create the strength on a regular basis. And maybe at the end of the day, if you have a sit-down kind of job, that's to be done at that time as well. So twice a day, 10 repetitions, 3 to 5 second holds. Those are the basics of reps and sets to do, and I hope you find them valuable. Essential fatty acids. The third component that could be the best kept secret in reducing inflammation in chronic low back pain. Essential fatty acids are required to be consumed from the diet and into our bodies. Our bodies cannot make them, hence why they call them essential. And these 20 carbon chains of fatty acids come in the most basic 2 types, omega-3 and omega-6. Omega-6 is easily available in today's dietary consumption from a lot of the seed oils, corn oil, soy oil, canola oil. These are in many different types of foods. Omega-3s are not so rampant in our foods and must be consumed, because if we don't, the ratio of omega-6 and omega-3s gets distorted. They're supposed to be 1-to-1, but because of the diets today and how easily most of the omega-6 oils are around, the ratios are now like 25-to-1. So that sets us up for our bodies to produce a more pro-inflammatory type chemical releases in joints and nerves and all the tissues of the body. And so one of the best ways to drive the ratio back towards 1-to-1 is the addition of omega-3 fatty acids. And the best source comes from molecularly distilled fish oils. It's important to consume a supplement that's been distilled, molecularly distilled, all the impurities, dioxin, PCBs, all these have been removed from our polluted waters around the world. I love this brand called Innate Choice. Is the one I take myself. It's one of the things I take on a regular basis. And again, I don't necessarily suffer from chronic low back pain, but it's been known to have health improvements for brain, heart, and joint function. So I do take it as a proactive basis to be able to create a non-inflammatory chemistry within my own body. They come in pill forms, and they also come in liquid type forms. Some people do not like the taste of an oily type taste. They make it with a lemon type flavor, again, which not very fishy at all. We put it in our kids' smoothies, a tablespoon once a day with a smoothie. Some people put it in, if they're younger kids, they eat it in their applesauce. Some put it on salads. If you hate an absolute oil in your mouth, then the capsules are your next best bet. I want to reference a very powerful article that was published in Neurology 2006 by a Dr. Joseph Charles Maroon. And the title of the article was Omega-3 Fatty Acids, Fish Oils, as an Anti-Inflammatory, an Alternative to Drugs for Discogenic Pain and Surgical Neurology 2006. The summary: they found that the use of non-steroidal anti-inflammatories, which a lot of people take for chronic back pain in general, was associated with extreme complications, including ulcers, bleeding ulcers, which are very dangerous, causing heart attacks, strokes. These are very serious consequences of chronic use of non-steroidal anti-inflammatories. So this study that they designed, this was a summary of what they found, is that after 75 days of taking fish oils, almost 60% of patients were taking NSAIDs for chronic pain, had degenerative spine disease, were able to discontinue the prescriptions of NSAIDs, and stated that they had an 88% improvement in satisfaction with the control of pain by adding omega-3 fatty acids into their diet as a supplementation. And the third part is that they found there was no side effects. That's amazing. Okay, so there's no side effects taking the fish oils. So the only thing that they commented here was to have the anti-inflammatory dose of fish oils, you require 2.7 grams or more of the fatty acids. So depending on the EPA content, which is the driver of the anti-inflammatory effect, you'll want to be taking the appropriate dosage. So if a capsule, for example, is 500, we need to be taking probably 5, closer to 6 to get over that level of the 2.7 grams in that category to create it. And they did find as well that they had to take it for 75 days before they noticed the biggest effect in the anti-inflammatory effect. So that's about 2.5 months of time before it really kicked into the body to really drive down the anti-inflammatory effect by just consuming this, which has so many more benefits than just reducing inflammation and joint pain, but there's so many improvements to mental health, heart function and brain function, because they're the requirements for the cell membrane as a whole, neurotransmitters and such. So please consider getting a good quality fish oil, preferably molecularly distilled 3 times. Like an Innate Choice is the brand that I love and I take with me and my family. So that's the third component to this process of how to reduce chronic back pain, with stretching and strengthening exercises and adding this supplement to reduce inflammation down. So now I want to hear from you. I want to hear what you liked. Have you tried the exercises? Can you do them? Are you okay doing them? Do you take fish oils? Are you found to be effective? Are you taking the proper dose? So again, if you like this video and you want to see others, you click here. Here's another video that I made on the best ways to reduce degenerative arthritic low back pain with the best exercises. So just click here and you'll get right to that video. So hope you've enjoyed that video. Comment below. Please share with others who are suffering as well if you find it helpful, and subscribe to the channel. Talk to you soon. Bye for now.